Turner syndrome is a genetic disorder. Look at this picture, shows that signs and symptoms. Echocardiography findings. Then disease mechanisms. Look at this picture. Detail going on. Introduction. Turner syndrome is a genetic disorder that affects females and is characterized by partial or complete absence of one of the X chromosomes. It is a relatively rare condition occurring in approximately 1 in 2500 live female births. The syndrome leads to a variety of medical and developmental issues, including short stature, ovarian insufficiency, and congenital heart defects. A definition: Turner syndrome is a chromosomal disorder in which a female is either partially or completely missing one of her X chromosomes. It affects growth and development and can have significant medical and psychosocial implications. Etymology: Turner syndrome is named after Dr. Henry Turner, an American endocrinologist who first described the condition in 1938. The term syndrome refers to the collection of characteristics, symptoms, and features associated with the chromosomal disorder, which involves the partial or complete absence of one X chromosome in females. Types: 1. Classic Turner syndrome, complete absence of one X chromosome, 45X. 2. Mosaic Turner syndrome. Some cells have the usual excess chromosomes while others have only the one X chromosome. 3. Partial deleted Turner syndrome. A portion of one X chromosome is missing or structurally altered. Causes: Turner syndrome is caused by a random error in cell division during the formation of reproductive cells or in early fetal development. It is not inherited but occurs as a result of non-disjunction or chromosomal abnormalities. Risk factors: 1. No known environmental or genetic risk factors. 2. Advanced maternal age is not a contributing factor unlike other chromosomal abnormalities such as Down syndrome. 3. Occurs randomly in the general population. Complications: 1. Cardiovascular issues, congenital heart defects such as coarctation of aorta. 2. Endocrine disorders, hypothyroidism, diabetes, and osteoporosis due to estrogen deficiency. 3. Infertility due to ovarian insufficiency. 4. Kidney abnormalities, structural defects in the kidneys. 5. Hearing and vision problems, increased risk of ear infections, hearing loss, and strabismus. 6. Psychosocial challenges, increased risk of social anxiety, difficulty in interpersonal relationships. Pathophysiology: the absence or structural abnormalities of one X chromosome leads to cascade of developmental disturbances and disruptions, particularly affecting growth, reproductive systems, and development, and cardiac function. Insufficient estrogen production contributes to osteoporosis, while growth hormone deficiency results in short structure. Pathophysiology of Turner syndrome, step by step process. 1. Chromosomal abnormalities. Turner syndrome results from the complete or partial loss of X chromosome or structural abnormalities of the second X chromosome in females. 2. Early embryonic development impact. The missing genetic material affects normal embryonic development, particularly in tissues that requires both X chromosomes for growth and function. 3. Gonadal dysgenesis. The absence of second X chromosome lead to ovarian dysgenesis resulting in reduced estrogen production and primary ovarian insufficiency. 4. Hormonal imbalance. Low estrogen levels leads to elevated follicle stimulating hormones and luteinizing hormone due to a lack of negative feedback to the hypothalamic pituitary axis. 5. Short structure and skeletal abnormalities. Haploinsufficiency of the SHOX gene located on the X chromosome contributes to short structure and skeletal deformities such as scoliosis and Ubitus valgus. 6. Cardiovascular defects, structural heart abnormalities such as co-articulation of the aorta and bicuspid aortic valve arise due to disrupted vascular development. 7. Lymphatic dysfunction. Abnormal lymphatic development leads to congenital lymphedema, causing swelling in the hands and feet at birth. 8. Metabolic and endocrine issues increase the risk of hypothyroidism, insulin resistance, and osteoporosis due to estrogen deficiency. 9. Congenital and social development. While intelligence is usually normal, some individuals may have difficulties with spatial reasoning and mathematics and social cognition. 10. Infertility and puberty issues. Most affected individuals experience delayed or absent puberty and infertility due to ovarian failure, though associated reproductive technologies can help in some cases. Turner syndrome affects multiple organ symptoms and early diagnosis with growth hormone and estrogen therapy can help manage its complications. Signs and symptoms. 1. Physical features, short structure, webbed neck, low hairline, broad chest with widely spread nipples. 2. Reproductive issues, delayed puberty, ovarian failure, and infertility. 3. Cardiovascular problems, hypertension, congenital heart defects. 4. Other features, frequent ear infections, kidney abnormalities, learning disabilities. Especially in spatial and mathematical reasoning. A diagnosis. 1. Prenatal diagnosis, karyotyping through amniocentesis or chorionic values sampling. 2. Postnatal diagnosis, physical examination, karyotyping and genetic testing. 3. Additional testing, hormonal test, echocardiogram, renal ultrasound and hearing tests. Nursing diagnosis: 1. Impaired growth and development related to chromosomal abnormalities. 2. Risk for low self-esteem related to delayed puberty and infertility. 3. Ineffective coping related to social and psychological challenges. 4. Risk for impaired cardiovascular function related to congenital heart defects. 5. Knowledge deficit regarding condition and treatment options. Medical management: 1. Growth hormone therapy to improve height. 2. Estrogen implement therapy for secondary sexual development. 3. Treatment for associated conditions like hypertension and diabetes. 4. Associated reproductive technologies for fertility preservation. Nursing management: 1. Monitoring growth and development. 2. Providing emotional support and counseling. 3. Educating the patient and family about the syndrome and its implications. 4. Assisting in medication adherence and follow-up care. 5. Encouraging social interactions and self-confidence building. Treatment options: 1. Hormone therapy, growth hormone and estrogen replacement. 2. Surgical interventions, corrective surgeries for heart or kidney defects. 3. Fertility treatments, egg donation and in vitro fertilization options. 4. Speech and occupational therapy to address developmental delays. 5. Psychological support, therapy for social and emotional challenges. Psychosocial medicine: 1. Counseling and psychotherapy to help with self-esteem and coping. 2. Support groups encouraging connections with others facing similar challenges. 3. Educational support, tailored learning strategies to address cognitive difficulties. 4. Parental guidance, educating families on effective communication and support techniques. 5. Behavioral therapy, managing social anxiety and improving social skills. Prevention, as Turner syndrome is genetic disorder caused by random chromosomal abnormalities. There is no known prevention. However, early diagnosis and intervention can help manage symptoms and improve quality of life. In conclusion, Turner syndrome is a complex genetic disorder that requires a multidisciplinary approach for management. With proper medical care, hormonal therapy, and psychosocial support, individuals with Turner syndrome can lead to healthy and fulfilling lives. Early intervention and education about the condition can significantly improve outcomes and quality of life. Thank you. Have a nice day.